Afternoon is Dr. Trudy Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to our community health clinic. Today we're going to talk about a phenomenon which, though rare, but lately has been happening. So in next few minutes, we'll talk about vanishing twin syndrome. Vanishing twin syndrome. This is very important, especially to our members who are expecting multiple babies. So this afternoon, we're going to do justice to this very rare, but lately, a phenomenon that can happen. Matter of fact, the reason why I chose this topic is because one of my clients told me recently that her friend had the experience of this missing communication between a normally developing pregnancy, then suddenly one vanishes. So this afternoon, we'll talk about the so-called vanishing twin syndrome. So when you come in, let me know who you are. Let me know your location. Focus on my admin. Pay attention. You will see the reason why it's very important to seek medical care, especially if you're pregnant. It's very important to pay attention, okay? Now, please, when you come, my admin is going to be in full attendance. So expect to see Dr. Ndichie, expect to see Kene, the Chief Operating Officer, expect to see Chinyere, expect to see Onyinyechi, then Ebenezer. So we have a full house, and I'm going to count down to 50. The number to beat is 50. Now, a couple of things you need to be conversant with. On the 25th of this month, we have a big event. It's called Assisted Reproductive Technique Symposium. Assisted Reproductive Technique Symposium will grant you the opportunity to have your full knowledge about IVF, about IUI, about surrogacy, about donor eggs, about donor sperm. Things you need to do so you can become exactly who God said you will become. It will be a very important opportunity if you are planning to go for IVF, if you are planning to go for IUI, if you don't understand surrogacy, if you're wondering what donor egg is all about, if you're wondering what donor sperm is all about, please register for this event and we'll be there to help you to understand better. Also, remember we have a couple of services in the group. So if you want to consult with us, please come in through the right way. You can sign up for 1 week, 1 month, 3 months, and 6 months. If you are already pregnant, please register for the groups A and C. It's in Telegram. If you are planning to become a mother in 2022, we have a special group for believing for baby mothers in our Telegram. So we have 2 group consults. Telegram for A and C. A and C is for women that are already pregnant. So whether you're in your first trimester, second trimester, or last trimester, you need help. You cannot afford to make mistakes in your pregnancy. So I'm actually going to start. When you come in, confirm you can hear me clearly, okay? So I will try my best to give my presentation, then I'll take care of your questions. So in vanishing twin syndrome, for some reasons, you confirmed your pregnancy through urine. You confirmed your pregnancy through the blood. Then you followed up. You went to your doctor. You went to a sonographer. So a sonographer is the person that will conduct ultrasound. Ultrasound can be either transvaginal ultrasound or intra-abdominal ultrasound. So in course of checking for your ultrasound, we discover you're carrying more than 1 baby. The process of carrying more than 1 baby is called multiple pregnancy. Your multiple pregnancy can be natural, or your multiple pregnancy can be subsequent to assisted reproductive technique. So either you went for IVF, or you had surrogacy, or you had IUI. But we confirmed you are having more than 1 baby. Then suddenly, you will go back again to continue your ANC visits and will discover that you no longer have those multiple pregnancy, that you have either lost one or two or three. So suddenly, your twin pregnancy will now become only one. The other twin will vanish. This is a very terrible thing to happen. This is a big, big tragedy to happen to a lady or a partner expecting twins or triplets or quadruplets. It is very rare, but it can happen. Now, when you have this problem, it's important it's managed properly. It is very, very rare, but because lately we have modern technology of going for ultrasound, it is now commonly discovered that some people can have this. So in as much as it's very, very rare, because of the advent of ultrasound, when women have this problem, we can discover it on time. So let me explain again. In vanishing twin syndrome, for some reasons, suddenly one of your twins will vanish inside your belly. Now, what happens to that baby when the baby vanishes? The body of the mother will absorb that baby. So that baby will no longer be viable. Viability in pregnancy means the pregnancy is developing okay. So in vanishing twin syndrome, suddenly a woman that is carrying more than one baby, twins, triplets, quadruplets, will either be carrying only two. So you can have a situation where a woman succeeded in carrying multiple pregnancy through IVF. You originally were carrying more than two babies, so you have four babies. Suddenly, when you go back, we only see three babies, or we only see two babies, or you were expecting triplets. Suddenly, we go back, you only have one baby remaining, or you were expecting twins. Suddenly, we go back, you only have one baby remaining. Now, when that baby is no longer viable, that means you have lost the baby. The baby has vanished inside your body. Now, there is a difference between this and miscarriage. Miscarriage can happen very early. In miscarriage, parts of the baby can be seen outside the body of the woman. So miscarriage is the unintended loss of your pregnancy before 20 weeks. After 20 weeks, it's called stillbirth. So the difference between vanishing twin syndrome and miscarriage is the fact that there is absolutely no sign that you've lost your baby. But when you go back, we no longer see your twin baby. It has completely vanished in the body of the mother. Now, this is the deal. We don't know exactly the likely cause of this. But just like other pregnancy losses, we understand that genetic problems, chromosomal abnormalities can be top on the list of things that can lead to this. Now, commonly, vanishing twin syndrome, it's normally seen in non-identical twinning. So it's not commoner in identical twins. Remember, in identical twins, they are practically the same. The only difference is that when we fertilize an egg, it divides into two to produce exactly the same type of individual, but different. In what we call fraternal twins, two eggs will be released, and those two eggs can be fertilized. So the difference between vanishing twin syndrome and miscarriage is the fact that if you are having miscarriage, some women will bleed, some women will have cramping, some women will find water coming out of their body. But in vanishing twin syndrome, the baby is completely absorbed in the body of the mother. Now, in some situations, when we proceed in delivering the babies remaining, we will discover remnants of the baby that vanished. It will become what we call mummified. So remember the Egyptian mummies. So that means when we open the woman up during delivery, we will find the evidence of the baby that couldn't make it. Now, in some other situations, the baby that survived will inherit the DNA of the baby that didn't make it and will have dual individual in one person. It's called chimera. So these are very, very rare conditions, but it can happen. The reason why vanishing syndrome can happen right now is because of the increase in the technology of knowing that a woman is pregnant. This is the reason why you must be careful, so that when you are confirmed pregnant, don't just depend on the urine test. Don't just depend on the blood test. You must go for ultrasound. Ultrasound is the clinical evidence that you are pregnant. So ultrasound will show us that the baby is developing inside the womb. Unfortunately, some pregnancies might not be viable. So what do I mean by non-viable pregnancies? You were actually pregnant, but unfortunately, you lost your pregnancy. So you can have what we call missed abortion. You can have molar pregnancy. You can have chemical pregnancy. You can have an embryonic pregnancy or blighted ovum. And you can also have ectopic pregnancy. These are all pregnancies that are abnormal. The baby is no longer viable. Now, the beauty of multiple pregnancy when you have vanishing twin syndrome is the fact that in most situations, the woman will continue to carry the remaining baby as if nothing happened. But this is where we need to be careful, because you are now a high-risk lady. So you have to be frequenting the clinic. We have to be keeping an eye on the baby to make sure that the surviving baby is properly taken care of. Vanishing twin syndrome, it's very painful. So imagine yourself preparing your home for twins, and suddenly they tell you you can no longer have twins. You are gonna be worried. You are gonna be stressed out. Some women will be depressed. Some women will not find any interest. Some women will start having psychological problems. But remember, you are still a mother. You still have the baby remaining in your belly, so you must be careful. This is the reason why all pregnant women must, as a matter of principle, check in with a qualified obstetrician. So the fact you got a pregnancy test positive in your urine is not the end of the world. You must follow up with corresponding blood tests. You must follow up with corresponding ultrasound. We must have evidence that that baby is developing inside your womb. So if you are following me this afternoon, if you have been confirmed pregnant through urine, remember the short pregnancy hormone is beta HCG, beta human gonadotropin, beta human chorionic gonadotropin. This is the hormone we measure in your urine and blood to tell us that you are pregnant. Now, when you have done your blood test, don't go home yet. You need your ultrasound. Ultrasound can be through the vagina or through the belly. It's important it is done. You cannot afford to be carefree. So all pregnant women in our group, as of this moment, I encourage you to register for our ANC. Now, I understand the pain of anticipating twins, and suddenly you are told you are only going to have one baby. It's very painful, but we must be careful to make sure that the surviving baby is delivered okay. So very, very important topic. If you've had anybody that had this experience, they need a lot of support. They need a lot of psychological support. They need a lot of emotional support. They need a lot of medical support. In most situations, when you have vanishing twin syndrome, the surviving baby will be okay. Nothing will happen to the baby, but we need to be sure. Unfortunately, if the babies that had this problem, if they share a lot of organs together, then the likelihood that the surviving baby might have a lot of complication is high. So it's something that will warrant you to follow your doctor religiously. So please make sure you register for our ANC so we can keep an eye on you. Now, this is what you need to know. Management of vanishing twin syndrome is conservative, is observational. So we will be giving the woman an appointment to be coming frequently. We'll check the blood level of the beta HCG. We'll make sure that it is doubling. We'll check ultrasound. We'll make sure that the surviving baby is okay. We make sure that the surviving baby has enough fluid. We make sure that all the organs are intact. So it's an emergency that must be followed up immediately. And the best way to do this is to make sure you follow up with a high-risk pregnancy specialist. So if you were carrying twins and suddenly you are carrying only one baby, you need to be careful. A specialist must follow your condition and make sure that the baby is 100% okay. So this is my quick delivery on vanishing twin syndrome. I'm now gonna open the clinic so I can start taking care of your questions, okay? So give me 1 minute, let me start taking care of your questions. So if you have any questions, this is the time to ask, and I will attend to your questions. Okay, so let's see what we have. Okay, so please go ahead and ask your questions. If you have any questions, it's time for questions. So please go ahead and ask your questions. The clinic is open for questions. The clinic is open. Please ask your questions in real time. I will provide you feedbacks in real time. I have 15 minutes to take care of your questions. Even if your questions are not related to vanishing twin syndrome, please make good use of this opportunity. If you are not able to subscribe for 1 week, to subscribe for 1 month, to subscribe for 3 months or 6 months, or ANC or BFB, this is your opportunity. So my clinic is mainly for women that might not be able to offer the services we have. But everybody is welcome to use the services they can afford. If you have the resources, sign up. The earlier you sign up, the better for you, okay? But guys, ask your questions. Ask your questions. The clinic is open, and I'm ready to take care of your questions, please. Admin, please, if you see any questions on the floor, you can repost. If you want to subscribe, follow my admin, and my admin will attend to you appropriately. But for now, please go ahead and ask all your questions. Okay, I have one question. Okay, let's see what we have. Okay. Is it possible for one to be pregnant of twins and the twins will vanish? Unfortunately, it can happen. So remember, multiple pregnancy on its own is an abnormal pregnancy. Normally, the womb is structured in such a way to carry one baby. So unfortunately, you can lose your twin pregnancy. This is where you need to be careful. When you are having twins, it's a very big risk. So you have to be frequenting your ANC. We have to keep an eye on your pregnancy and make sure that any problem we discover will be addressed. Unfortunately, you can lose your twin pregnancy. But when you lose your twin pregnancy, it's not the same thing with vanishing twin syndrome. In vanishing twin syndrome, one of the babies will disappear inside the womb and the other baby will still continue. Okay, so guys, let's continue, guys. Keep asking your questions, please. Okay, hold on. It's time for questions. Okay, let's see. Okay, so this person is asking, can one be pregnant and the normal scan will not see the baby? No, my dear. Once you are confirmed pregnant and your baby is up to the time we can discover the baby in a scan, all babies must be seen in the scan, must. Now, this brings me to a couple of places in Africa where they promise you, oh, when you're pregnant, please don't go to the hospital. Every singular pregnancy must show evidence in urine, in blood, and ultrasound. When you are pregnant, we need to see that baby inside the womb. Now, here is the deal. If you check the ultrasound too early, it might not be there might not be any early evidence that you are pregnant. But over time, we have to see the gestational sac which is an evidence that you are pregnant. We have to see the gestational pole inside your womb. So all pregnancies must be seen when you go for ultrasound. I know where you are coming from. Some women might go for the so-called phantom cryptic pregnancy, and they might give you a couple of medications and they will blow your belly up and they will tell you you are pregnant when you are not pregnant. And they will tell you not to see the doctor. Every singular pregnant woman must show evidence that they are pregnant in their urine, in their blood, and in your ultrasound. Okay, so let's continue, guys. I love that question. Very good question. Okay, guys, keep asking your questions. Okay. Let's see. Is it better to evacuate the remaining one when the other one has vanished? No. Remember that the remaining one is already absorbed from the body into the body of the woman, right? Now, once you are pregnant, we do not tamper with the belly. We do not tamper with the womb. Do you know why? Remember that when you are pregnant, it's expected that your cervix is completely closed. So we cannot afford to tamper with the ongoing pregnancy, because if we try to do anything that is not indicated, we can end up losing the remaining baby. So we don't go for evacuation. The remaining baby will be fine. In some situations, some women will bleed. That bleeding might be a sign that one of the other baby is no longer viable. The majority of women that will have vanishing twins, the surviving baby will be fine. But we don't need evacuation, okay? Let's continue, guys. I love that question. Okay, let's see another question. Okay, is it possible to miscarry one twin while the other one remains growing inside? That's exactly the topic for today. So in vanishing twin syndrome, which is not miscarriage, for some reason, one of the babies vanished inside the body of the mother and gets absorbed. The remaining baby continues. So this is exactly what I'm explaining to you guys today. So yes, my dear, it can happen. Okay, let's continue, guys. Okay, let's continue. Okay, are there known predisposing factors for vanishing twin syndrome? No, my dear, it's grossly unknown. But what we know for sure is the fact that it's likely due to genetic abnormality or chromosomal abnormality. Unfortunately, you can't do anything about chromosomal abnormality. So some of the babies might have extra chromosome or lesser chromosome. So it's a completely genetic thing that nobody can predict, nobody can stop. If it's going to happen, it's going to happen. Okay, let's continue, guys. Okay, let's see. Doc, can nipple pain be a sign of pregnancy 3 days after ovulation? Yes. Some women can have what we call breast tenderness. So nipple pain is part of the breast tenderness. Tenderness means when we touch your breast, you begin to feel pain. It's part of the hormonal changes. Now, that alone might not be a sign of pregnancy, because some women can also have tenderness when they are ovulating. Some women can have tenderness when they are bleeding, and some women can have tenderness when they are pregnant. So the fact you have tenderness in your breast alone is not the only criteria to know if you are pregnant. The only way to know if you are pregnant is to conduct the 3 investigations: your urine, your blood, and ultrasound. There is nothing like I feel like I'm pregnant. There is no such thing. It's either you're pregnant or you're not pregnant. So to avoid heartache, to avoid stressing yourself, go and buy urine pregnancy test strip. About 7 days after your missed period, check for pregnancy. If you are blessed, if you confirm pregnancy, don't stop there. Call your doctor. Go in for the blood test. The blood test is both qualitative and quantitative test. The quantitative test will tell us how the beta HCG level is going. Is it doubling within 72 hours? So it's important that all pregnant women go for urine test, blood test, and ultrasound. Okay, let's continue, guys. I love the questions I'm getting today. Dr. Ndiche is also in the house, so she'll be providing you feedbacks. Okay, let me see this one. Are women with automatic disease high risk? Do you mean autoimmune? So I want to believe you are asking about autoimmune diseases. We don't have any study that proved that. So right now, vanishing twin syndrome is grossly unknown. The phenomenon, it's unknown. There are a couple of things that happen in medical practice. We haven't found exactly what leads to that. Vanishing twin syndrome is one of them. Now, women that have autoimmune disease can have different presentations. So in autoimmune disease, what does it even mean? It means that your body is attacking your body. So instead of the immune system that protects your body, instead of protecting your body, your immune system will generate things that will start attacking your body. In medical practice, there is something we call antigens and antibodies. Antibodies are like soldiers. So in autoimmune disease, instead of your body immune mechanisms to be protecting you, they will be attacking your body. So it's equivalent to slapping yourself. It's equivalent to hitting your head on the wall. So in autoimmune disease, your body is simply attacking your body. There is no connection between autoimmune disease and vanishing twin syndrome. I love that question. Okay, guys, let's continue. Okay, let's see this one. Okay. Is it possible for women not to ovulate every month? Yes, especially if you're older than 35. So it's not all women that ovulate every month, even younger women. But here is the deal. You are expected to ovulate at least 9 times out of the 12 months of the year. So if you are within your reproductive age, for some reason, some women will have skip ovulation. So you can ovulate in January, you won't ovulate in February, you ovulate in March, you keep skip. But we anticipate that if you are younger, you are at least expected to ovulate up to 9 times in the 12th calendar year. Okay, so it's not every month you ovulate. Now be careful. The fact you are not ovulating might be a sign of changes in your body, especially if you are older than 35. If it's confirmed you are not ovulating, we need to fix it. We need to manage it. We can give you ovulation induction drugs, which is the category where your clomid belongs. Then we can look for alternatives. This is why you need to be careful. If you are 30 years and above, 35, because at 35 years and above, your chances of becoming pregnant naturally is dwindling. Your fertility is dwindling. Why? Because you have more probability of having more abnormal eggs. But when you are younger, you have a better chance. But we also have an advantage. So if you are above 35, in as much as pregnancy might be difficult, but when you eventually become pregnant, you have a better chance of having twins. Okay, so let's continue, guys. I have 3 more minutes. Okay, thank you, Dr. Ndiche, for providing feedbacks. So let me quickly attend to a few other questions, then we can go for the day, okay? Make sure your questions are very brief. I'm going to post my transcript, so don't worry about it. If you didn't pick up a couple of the things I mentioned, I'm going to post my transcript so you can understand better, okay? So let's look for questions, please. Give me 1 minute. Okay, hold on. Yeah, for some reason, navigating through my phone, if I'm not at home, it's more difficult, but it's okay. Just give me 1 more minute. Dr. Ndiche, you can also continue providing them feedbacks. Okay, just like you're already doing. Thank you so much. Okay, guys, it looks like I don't have any other new question. But if I do, I'm going to provide you feedbacks. All the links for people that want to subscribe, it's being shared. If you are planning to go for IVF, if you are planning to go for donor egg, donor sperm, surrogacy, please attend the symposium. It will help you. Don't spend a lot of money when you don't even understand what you're going in for. Come and learn. Knowledge is the new oil. If you know better, you can act better. So don't blame anybody when you go and waste a lot of millions and you don't know about what you're going in for. And they tell you, oh, madam, so sorry. Sorry cannot give us babies, okay? Okay, let's see. Okay. Please, can pelvic inflammatory disease cause infertility? Yes, 100%. So 2 types of organisms that can lead to pelvic inflammatory disease is chlamydia and gonorrhea. Both of them are sexually transmitted infection. If you pick up chlamydia and gonorrhea, which you can completely treat within 1 week with appropriate antibiotics, if we don't take care of them, they love the tubes. So they can go to your tubes and damage your tubes and lead to what we call pelvic inflammatory disease. Pelvic inflammatory disease can lead to blockage and adhesions. When you have blockage and adhesions in your tubes can no longer perform its original role. For you to become pregnant naturally, you need at least 1 open tube. But when you have PID, which has damaged your tubes will be blocked. When your tubes are blocked, the eggs cannot come in, the sperm cannot come in, fertilization cannot happen. But here is the good news. Even if your tubes are damaged, you can still become pregnant, but you need to go for IVF. So if you have been told that your tubes are bilaterally blocked, that means that both tubes are blocked. Please stop wasting your time with the money you don't have, going from one place to the other for them to flush it. If it's confirmed that your tubes are blocked, both of them, go and save money and go for IVF immediately. The earlier you go for IVF, the better for you. Okay, so guys, my time is up. Thank you for coming. I appreciate you. Make sure you follow Dr. Ndichie tomorrow. I will also show up for my lunchtime clinic. Please don't allow 2021 pass you by. I am pleading now. Next year is celebration. Don't carry over your infertility to 2022. Go above and beyond to use your resources, to get the knowledge you need, to change your attitude, to change your practices, so you can be a mother. 2022 is the year of Jubilee in our group. We are all gonna be mothers, we are all gonna be fathers, so please stop wasting time, especially if you are above 35. You no longer have that liberty of wasting time. If you need help, we can help you. Follow admin. You can use as little as 2,000 naira to get help. If you are able, you can come in for 1 month, you can come in for 3 months, you can come in for 6 months. When you are coming in for 3 months and 6 months, you will have an opportunity to talk to me one-on-one. I can also talk to your partner, and together we can crack infertility. The essence of SGHS is to defeat all forms of infertility. The reason why I show up is to break the backbone of infertility, stopping our women from becoming mothers. This is my mission. This is my why. If you need help, I can help you. But if you don't show up, how can I help you? Remember, regardless of what the diagnosis is, continue praying to God. Prayer is the ultimate key. When you have prayed, follow up with your partner. Make love 48 hourly. When you are done doing that, continue practicing. You need a fertility specialist. Make sure you check all the boxes. If you were told you need IUI, go for it. If you were told you need IVF, go for it. Donor sperm adoption, surrogacy, whatever you need to do to become a mother in 2022, whatever you need to do to become a father in 2022, do it today. If God gave you the resources, don't keep that money in the bank. Go and use the money and get the best help. Unfortunately, it's expensive. If you need to leave your abode and travel to the place you get help. So many people are going home. Unfortunately, we can only refer you back home in Nigeria. So God bless you for coming. I love you guys, and I'll see you guys tomorrow. Until I see you, God bless you, and bye-bye for now.